On this episode,
Those photos of Pawpaw are horrific.
brave Pawpaw has had a tough start.
They are possibly, in 15 years, the worst hips I've ever seen.
Oh no!
Will Kate be able to give her a brighter future?
I have a feel of his head. Wow.
And a career first for Scott when he x-rays elderly Shih Tzu Maximus.
Unicorns really do exist. Wow.
It's kind of that intriguing, disgusting.
And what's wrong with rabbit Chimera that stunned Audrey and Alison?
It looks like an alien. I've never seen anything like it. Oh my god. Yeah.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
Our very first consult of the day, Alison, is going to be one of your favourite animals. Dog.
Not a dog.
Cat, not a cat. It's a rabbit. A rabbit. Yep.
In New South Wales, Alison and Audrey are answering an SOS about a tiny patient who's had a tough start to life.
And this one's a really special case. It's really sad. It's going to pull at your heartstrings, but it's a rescue bunny and it's come from the rabbit sanctuary.
And she's a good boy.
Emily is a volunteer with the organisation The Rabbit Sanctuary, which has been rescuing and rehoming rabbits for 14 years.
And she's good.
The Rabbit Sanctuary is all run by volunteers and we do it because we love it. At the end of the day, it's about rescuing these rabbits and giving them the best lives possible. Kissy kissy.
Emily is hoping the twins will be able to treat one-year-old Chimera after she noticed some nasty abscesses on the young bunny.
Chimera was surrendered by a girl who did a mass rescue from a hoarder situation, and there was 6 rabbits that had abscesses. See you, friend. Good boy. They were all treated with antibiotics, but Chimera in particular was the worst. The abscesses kept returning. So I called Alison and Audrey today because they're growing and getting bigger and we're really quite concerned.
Hi, Emily. Hi, Chimera. So tell us a little bit about Chimera's rescue and where he's come from.
So Chimera was rescued in a hoarder situation and the person rescued 22 rabbits.
Oh my goodness.
Yeah, he's quite underweight as well. And she was at the point she was ready to euthanize him, but thankfully she did contact us.
So Emily tells us about Chimera's story and it's heartbreaking. He's malnourished. He probably has some liver or kidney compromise because he's had a terrible diet. And on top of that, he's got this weird mass or abscess that goes around his leg. He must be in a lot of pain. Yeah, well, it looks like he's come to the right place and you've already started everything you can to get him back to health. But obviously, what's going on with his weight is that abscess causing him to be really unwell. And we know with rabbit abscesses, they get out of hand and they can become, they can seed infection into the blood and make them really unwell. Yeah. Poor buddy.
It's okay. It's okay.
It's time to get a close look at the abscesses that antibiotics have failed to treat.
Here we can feel quite a large lump sort of extending around here, and there's obviously a wound there where the pus is coming through.
So abscesses are quite common in rabbits. We do see them quite a bit and they're very, very tricky to treat.
And I think rabbits, they can get it from a whole number of reasons. It could be a bite, it could be a foreign body like a grass seed that's tracked through, it could be a bit of bacteria just entered through the skin. And then what happens is that these abscesses become really thickened. They've got these capsules that are a couple of mil thick, so no antibiotic or anything can penetrate it to cure it. And that's why rabbit abscesses are a huge problem. Okay, oh, there it is.
That's quite massive.
And if you feel it, it's actually a really weird shape. It feels kind of lobulated. It's long on one side, it gets a bit bigger, and then it might even be connected to that one at the back. It's really weird, this abscess thing that's going on with Chimera. There's definitely one on the back thigh and there's one on the inside of the thigh, and then we feel a little bit more and it almost feels like they're connected through some sort of stringy abscess
like
connection.
A chain of pearls, but a chain of abscesses.
We call it a chain of abscess, and it's strange because I've never seen an abscess like that. I've seen round abscesses, oval abscesses, but something like this that goes from the back of the leg to the front of the leg is
Very strange.
Yeah, very, very weird.
And they're actually discharging. The abscesses have actually burst to some extent, and we can actually see pus coming out. So very, very sore.
It's lying actually on top of a few very critical structures. So if we were to go in and remove that, we've got to be really careful because there's some major vessels going just underneath it. And if we nick that, we're in a lot of trouble.
Infections from the mass of abscesses is rapidly spreading throughout little Chimera's body, and his condition is deteriorating. But emergency surgery is going to be risky.
So he's underweight, he could have some underlying liver and kidney issues, poor diet, and to put him under general anaesthetic, it's going to be a risk. It's also going to be a tricky surgery, so not the quickest surgery. So we've got to weigh up whether it's worth putting this boy under general anaesthetic to get it out. It comes to the end of the consult, and this is the difficult part because we've been processing all this information and it's not good news. He hasn't responded to any antibiotics. He's not a well bunny. He looks like he's going downhill, so we need to do something, and that decision is going to be hard. Emily has to make a decision for us to put him under general anaesthetic to get this abscess out, and there is a strong likelihood he could die. Alrighty, buddy. So I think, Emily, we need to have a decision on this. I know it's a hard decision.
Good boy, darling. Good boy.
In the UK, Brenda and her daughter Marie are walking 14-year-old Shih Tzu Maximus to the vets
This way, this way. You can't go in the shop.
very slowly.
This way, this way. If Max wants to walk one way, that's the way you're going to walk. You are not going to walk the way you want to walk. You're just going to walk the way Max wants to walk. This way. Oh, good boy.
In fact, Max's unique way of walking is why Brenda is bringing him to see Scott.
You come in here, darling. Good boy. Max's walk is very different. It's developed gradually from not being able to walk up the stairs and jump on the sofa to starting to limp, and then he developed a very weird way of walking to obviously overcome the problem. Sit down, darling.
Although Max hates coming to the vet and will try to leave at every chance,
He wants to get out and walk, doesn't he? He knows.
Brenda is worried her best friend is suffering and is hoping Scott can help.
Good boy. I love him so much. I just couldn't bear it now thinking that Max was in pain. He's everything to me. Oh, good boy. We've had him 14 and a half years now. We picked him up as a furry little bundle of fluff. We've been on a brilliant journey together, haven't we, Max?
Hi, Max. How you going? I'm going to speak loudly because I know you're an old boy. Hi, Max. How's it going? He's looking unimpressed. He loves a vet practice, doesn't he? Not really. Not really. Hello, buddy. How you doing? You're not going to get up? No? It's fair enough. So, I know that you're here for us to have a little look at his walking and his movements. So, should we let him move? He might run straight out the door, probably.
Very likely.
Should we give it a go? Should we let you off? Ready? Okay. Yeah, he's no Usain Bolt, is he? Maximus is a great little dog. He's very plucky, he's very tenacious, but he's also very old, and as a result, he does act a little bit like a grumpy old man. Come on. Max, hey.
Max?
Max. Hey. Hello, buddy. Hello. Come here. Come on. Come and see the vet. Come on.
Come on.
Come on.
Max, quick.
Come on. Good boy. Wow. It never ceases to amaze, that walk, does it? It's quite individual. I have never seen a walk anything like Max's. It is so strange. He walks with a head that bobs, and then his front legs are pointed outward, and then his back legs are even wider. It's amazing. Come on in.
But if Scott is to fix Max's strange walk,
Yes. That's your singing voice, isn't it? Yes.
first, he has to deal with the grumpy old dog's dislike for vets.
I know it's not good. Yes.
Slow down. Good girl.
Half a world away in Bondi, a similar story. Jack and Bridget are bringing Pawpaw to see Kate after noticing their 5-year-old rescue dog limping.
I love her so much. She's so special. Our lives focus around hers. It is very much a Pawpaw-centered world, and we're just living in it.
Yeah, it's true. Having that much love for an animal has definitely changed us.
Hi, how are you?
Good.
Hi,
How are
Dr.
you?
Kate.
Nice to meet you.
This must be Pawpaw. Hello. Come on in, you guys. So guys, Pawpaw, I've got that she has been a little bit lame.
So last year she had a TPLO on her right knee, and then recently we've noticed that she's started to lift up her left knee and her left leg, and we think
so
that
on
she's
the other leg.
on the other leg, and we think she may have done the exact same thing on that side.
About 12 months ago, Pawpaw had a TPLO, short for a tibial plateau leveling osteotomy. That's knee surgery because she busted a cruciate ligament. And when Pawpaw walks in, I can already see that she's lame. So she's a rescue dog, and you rescued her when she was how old?
6 months, and then there was multiple dogs and puppies on this property, and so she didn't get fed much. A bit of the survival of the fittest type, and Pawpaw is definitely not a survivor.
She was with a whole bunch of other dogs, and they were basically sort of fighting for the food, and therefore
Was really malnourished.
she was really malnourished.
And when you got her, she was not in great shape, I imagine.
Not in great shape.
When the foster picked her up, she was literally just like a bag of bones, like classic rescue.
Right. Those photos of Pawpaw, when I first saw them, are horrific. She looks at you with these eyes of sadness. That must have been just heartbreaking for you guys.
We loved her from the start, and she was like a little angel, but there was like a lot of anxiety, didn't want to walk. Yeah, I would say that's her main trait. Is
From the get-go, it was pretty obvious that she was going to have a lot of issues because of her start.
Are you a good girl? How did you get to be such a good girl? I don't know. Just am a good girl.
So I just want Pawpaw to have a healthy, happy, fun existence, and for her to not be in pain any longer.
But you notice how she's not actually putting any weight on that back leg. She's really painful in that knee. These are that bad. It could just be her arthritis, right?
Yeah, hope so.
So you call this is singing, is that right?
Yes.
In the UK, Scott is trying to find out why 14-year-old Max struggles to walk. But his nervous patient isn't making it easy. Even his loving owner Brenda's attempts to calm him down aren't working.
We had a difficult experience at one vet's, and ever since he's been absolutely terrified.
Wow, this dog loves to sing, doesn't he? He loves the sound of his own voice. Sounds a bit like me. Okay, so it's gone from singing to outright swearing, which just shows that that's the painful bit. And to think that that's not pain would be incorrect. It very much is pain. I am very concerned about why this hip is so painful. And in the cases of osteoarthritis, that's a slow, insidious onset. So you get more and more stiff, you get more and more sore as you get older and older. But Maximus has developed pain suddenly. All right, can I pick you up? What if I give you a man hug? Does that help? Does that make it better? Does that make it better? All right, okay. So look at me, I'm being a dad again. I'm just doing the parent jiggle just to kind of calm him down.
With Maximus now composed, Scott notices another abnormality on the ageing dog.
And also what's really bizarre with your dog is this unicorn bone on his head. What that? What is that? I mean, it's not something we'll need to do something with, but it's odd. So if it's okay with you, I'm going to take him downstairs. We'll give him a light sedation just to calm him down because his anxiety is obviously significant. So we're just going to help to just chill those nerves a little bit. Okay? Taking you away from your beloved mummy. And then we'll be performing the x-rays and then I'll show you them later. Best case scenario is that Maximus has really severe osteoarthritis and all we can do is help to manage him with pain relief. The worst case scenario is that there's something in that hip joint which is sinister like cancer. Unfortunately, that would mean that we'd have to say goodbye to Max.
Max means the absolute world to me. I can't imagine life without him. Yeah, so I'm hoping that, that it'll be a case of, yes, we can treat him.
Bye-bye, little one.
Say bye. Say bye.
Good.
See you soon.
Be good
Thank
boy.
you.
Thank you.
Bye-bye. See ya.
It's okay, sweetheart. It's okay. Good job. And can we have a feel of this bit?
In Bondi, Kate is examining rescue dog Pawpaw after her owners, Bridget and Jack, found the 5-year-old limping.
Ouch. Okay. That one's sore.
The German Pointer Bull Mastiff Cross had surgery on her right rear knee a year ago after tearing her cruciate ligament.
Okay.
You're okay.
That's fine. That's okay. Lay down. Lay down.
That's okay.
Can I have you there?
Okay, you're okay. Don't worry. I'm not going to touch your knee. As soon as I hit that left hind knee, she leaps. She is not happy with me doing that at all. So what we need to do now is we need to establish what is actually causing the pain. So guys, it definitely could just be an arthritic flare-up, but in saying that, it also could be her cruciate ligament, which is obviously what she did last year when she had the surgery on her knee. A lot of these dogs will within about 18 months have another cruciate tear on the other side. You've probably been told that before. So when it comes to repair of these types of things, medical management isn't great. So when we just brace them and we just use pain relief, nothing is actually going to replace doing a surgical intervention when it comes to a cruciate ligament. The cruciate ligament basically holds the two bones in the leg together. And if you don't have a cruciate ligament, you don't have any stability in the knee. So you notice that she's really painful in that knee. When they're medium to large breed dogs, like they just don't get any better.
Worst case is that we do have to do the surgery because I think any sort of surgery isn't ideal, but we've sort of been heading down this road for a while. Kind of knew the potential.
We were prepared for it to happen.
Yeah.
So I think what we should probably do from here is take some x-rays of the leg because it is quite painful for her, is that I think we put her under just a little sedation and just take some x-rays and see what's going on.
So Nathan, this is a little bit of a sleepy Max now. Had to give him a bit of sedation because he's quite an anxious old boy.
Scott and nurse Nathan are about to x-ray 14-year-old Shih Tzu Max, hoping to find out why he walks oddly.
Wow. It never ceases to amaze, that walk, does it? It's quite individual. First things first though, have a feel of his head. Feel this.
Wow.
What does it remind you of?
Well, it's sort of like a unicorn.
Yeah, that's what I said. It's like, I said, 25 years I've never diagnosed unicorn before, but it's properly growing out of his head. It is so bizarre. He has this lump on the top of his head. It is literally like a unicorn horn. It's like the nub, like you get on on a bull or a sheep.
Scott suspects the horny growth is harmless.
Okay, so now it's time for you to have a little bit of an afternoon nap.
The more serious task is to find out if Max's abnormal walk could be caused by an untreatable cancer.
Okay, x-ray. At the moment, he has two front legs that kind of bend outward. It's an issue from birth, it's a congenital defect. But this right back leg there is pain associated with that, and that's where I'm most concerned. Okay, so what we're looking at here is a very healthy left leg. A little bit of osteoarthritis in the knee, but you know, we're always going to expect that with a 14-and-a-half-year-old dog. Let's see what the right leg shows. I must say I was pretty nervous waiting for this x-ray to develop. And thankfully, I can't see cancer, which is excellent. Yes, he's got an arthritic hip, but that looks like all it is. For now, I'd say that there is absolutely life left in the old boy. He's still got some time on this planet. A massive relief for me, and for Max, and for Brenda. It is so cool, isn't it?
But before sharing the good news with Max's owner Brenda,
I've never felt anything like it.
Scott wants to take a closer look at the mystifying unicorn horn.
X-ray. I hope it doesn't do damage to unicorns.
Alrighty, buddy. So I think, Emily, we need to have a decision on this. I know it's a hard decision.
In New South Wales, sick rabbit Chimera needs urgent surgery on a mass of nasty infected abscesses.
There is a strong likelihood he could die. He's so malnourished, he's so unwell. It's a huge, huge risk.
Twins Alison and Audrey have explained to rescuer Emily the anaesthetic risk is extremely high.
Yeah, I mean, I think like you said, you know, we don't do it and his quality of life is just going to keep going downhill.
Yeah.
We really need him to get better, and it's a risk we have to take. We've tried medical options, it just keeps coming back, and really it's the only option.
So it's going to be a big day for you, buddy. Off to hospital?
I'm definitely anxious. I have lost a bunny before under anaesthetic, so I guess I'm a little bit more anxious than others. So I do a lot of pacing.
Okay, Emily, we'll be in touch. Don't worry.
Thank you.
All right, see you later. All right, here's Chimera.
A lot of fight here.
There we go.
Keep you nice and warm, buddy.
I can pop him on his side. That'd be easier.
Yep, that would be easier. Just watch his back. Just turn him down. You turn over here.
Alison and Audrey face a massive challenge. They must try to safely remove the long string of abscesses without nicking vital blood vessels.
Okay, so definitely now that he's shaved, that one is a lot bigger than we thought. And then there's this crazy kind of line of pus. And then it comes around this inside and then joins to this one. Weird. The abscess feels quite irregular. It's almost like a chain. But I want to know if they connect, and I also want to know if it's attached to any blood vessels or anything like that. Before we get started, I whip out my mobile ultrasound machine because I'm really interested to see how deep this abscess goes. Is it stuck to the femoral artery and vein? All of these things will prepare us for a better surgery. Ooh, there it is.
Oh gosh, look at how thick that capsule is.
Yeah, it's connected.
Is that?
Yep. So we get a couple of images and we find out that as well as being one that wraps around the leg, this abscess is actually attached to some major blood vessels, the femoral artery, the femoral vein.
And that means even the smallest accidental nick could result in fatal bleeding.
And we know we have our work cut out for us.
Hey mate, good boy.
On the Gold Coast, Alex has just started treating a 7-month-old Siamese cross after it got into a fight with a much larger opponent.
Why did you pick a fight with a dog? I heard you threw the first punch.
This is Diesel. His owners have rushed him in because he's been attacked by a dog. He swiped the dog and the dog grabbed him. At this stage, we don't know how bad his injuries are, but it looks like there's some bite wounds that might be under his coat.
I see the bruising coming out. Yeah.
Even though the injuries may not look big on the outside, there can be a lot going on the inside. So there could be crush injury, collapsed lung. I can actually feel air under the skin here, just around his hip. And that tells me there'll be a bite wound, most likely because air has got in and under the skin. So this little guy could be in a lot of trouble.
Anxiously waiting for word on Diesel's condition are owners Anton and Miranda. They're praying the fun-loving youngster will pull through.
He's so young, he's such a playful little character, and it was really sad to see him just lying there, you know.
I don't want my cat to have any serious injuries for the rest of its life, or worst case scenario, have to be put down. If that happens, then I don't know how I'll cope with that. I've got another video here of my girlfriend playing with him. He's really playful, he loves being played with. Well,
he was a girl.
He was originally, we thought it was a girl at first because we sold the cat as a girl, but then we went to get him desexed and we found out it was a boy. I thought it was a bit funny.
His name was Wendy.
Yeah.
So I'm just going to give him some pain relief. He's pretty bright, but dog bite wounds are painful and we need to make him as comfortable as we can. All right, Diesel. Good boy. Hey, I love your sparkly collar. Good man. There we go.
Now make you feel better. He's a good boy.
The worst case scenario here is he's been bitten by a large dog, about 30 kilos, and they have long teeth. And if those teeth have penetrated into his belly, then they could have gone into a vital organ, could have gone into his chest. Any of these things mean he would be in life-threatening danger. These are the kind of injuries that can be fatal. Just having a lot of trouble hearing his heart. I'm concerned that I can't hear his heart very well, and that could indicate some trauma in his chest. He's very quiet. He should normally be looking around and worried about what's going on. He's really not behaving like a cat who's just come into a hospital, into a new environment. So this is a real worry.
You're a good girl, aren't you? Such a good girl.
In Bondi, Kate is about to x-ray Pawpaw to see if the 5-year-old rescue dog needs major surgery on a damaged knee.
Can you come up on the x-ray table now?
Devoted owners Jack and Bridget wait patiently to see if their much-loved dog will have to undergo her second knee reconstruction in a year.
Looking forward to finding out what the prognosis is. We're ready to know if we're going to surgery or if we can manage this.
X-ray! Like Maria, look at how bad this hip is. So bad. Awful hips for her, and I cannot even believe that she can even walk around with these hips. In all the years that I've been a vet, I've never seen hips like this. It takes my breath away. I can't even believe that she is able to walk around and she doesn't whinge. Like, that's how bad they are.
The x-rays reveal Pawpaw has significant problems, including a cruciate ligament tear and arthritis.
They are possibly, in 15 years, the worst hips I've ever seen.
Oh no!
Like, I have never seen hips this bad.
Oh, that's so sad.
Jack and Bridget face some difficult decisions.
You can see this, appreciate you've got this like ring of where there's a lightening here, almost like a calcification around this edge of this. And at some point in life, we possibly have to talk about doing a total hip replacement, but not right now, because it's the knee causing the pain. This is the left knee, has significant arthritis. She's actually had a partial cruciate tear for a really long time. And now it's a full tear. Really the only way to go is a TPLO, or what they call a tibial plateau leveling osteotomy. Cruciate ligament surgery is a major orthopedic surgery. They take a long time to recover from, somewhere usually between 6 weeks and 3 months. They are especially hard work on the owners. And the poor little love, and you see from this just how important those early months are.
We loved Pawpaw. We didn't understand the amount of challenges that we would come up against. But it makes it easier when you fall in love with your pet and they're just a part of your family and you will do anything to make their life better.
You do like that. Do you want a tummy scratcher? Oh, that's a good one, isn't it? Pawpaw is absolutely gorgeous. She is one of the loveliest dogs I have ever met. And by some just really weird twist of fate, Pawpaw hit the jackpot. She has gone classic rags to riches story, and she's ended up with these two amazing people.
Hello, what is this cute antenna? Oh my goodness.
Bridget and Jack have decided to go ahead with reconstructing Pawpaw's painful, badly injured knee. Surgery is set for the following day.
All right, you guys.
Thanks, guys.
I'll see you later.
See you later.
He's really not behaving like a cat who's just come into a hospital, into a new environment. So this is a real worry.
On the Gold Coast, Alex is treating attack victim Diesel.
Good boy, Diesel.
But before she can start checking for any injuries, she's extremely concerned about his vital signs.
So we're going to pop an IV in and give him some fluids. This really quiet behaviour could be an indication that he's in shock. So getting an IV and giving him some fluids, we're just really trying to stabilise him at the moment.
You're a very good boy. You're a very good boy.
Signs of shock can be high heart rate and a dull mentation, and those things I'm seeing with Diesel. If Diesel is going into shock, it may mean he's not getting enough blood to vital organs like his brain.
Sitting on 93 and responding to oxygen, so he is oxygen dependent at the moment.
My worry with Diesel is he's getting quieter, like more dull in his mentation. You can see his eyes are half closed, and the worry is there something going on the inside that we can't see? Has he got internal bleeding? Any of these things that can happen when you have a large dog bite. It's okay. If Diesel's bleeding internally and we don't find out and do something about it, he could bleed out. He must be so scared.
Thankfully, I can't see cancer, which is excellent.
In the UK, Scott is massively relieved after discovering 14-year-old Max is free of cancer.
You okay, old-timer? You all right?
Now he's intrigued to find out what X-rays reveal about a strange growth on the elderly Shih Tzu's head.
X-ray. That is amazing. Nathan, come and have a look at this. Look at that.
Wow.
Unicorns really do exist. Right here in Richmond.
Do you think it's magic?
Of course.
Yeah, Maximus does sound a little bit magical, doesn't it?
It sounds a bit unicorn-y.
Yeah.
Yeah. That is just so incredible, isn't it? It's so cool to think after 25 years, I've diagnosed my very first dog unicorn.
Hoping for incredible news,
Just seems to have been forever.
Brenda and her daughter Marie wait anxiously for the results of X-rays on their beloved dog's arthritic legs.
Very nervous, I think we both are. It's just that not knowing, hoping for the best, stomach churning at the moment.
Hi guys.
Aww.
Come on through.
Hey.
There you go, there's your lad. Which way do you want him? There you go. He's still a little bit sleepy. I really can't wait to tell Brenda the good news. It's very clear how much she loves this dog. And after 14 and a half years spent with another being, you are going to be bonded. And your life will be irreparably changed when they go. And that's why I really love Brenda's joy at having Maximus back in her arms. Just to then show you the X-rays, so the news is good.
Is it?
Good.
Oh.
Yeah. So, good news. So I was quite worried as well, but thankfully he has the hips of an old man, but nothing more sinister than that.
Okay.
Yes.
Max will need ongoing medication to control his worsening arthritis, and Brenda will no longer need to stress about her beloved old dog's slow and awkward way of walking.
You are a gorgeous boy, and we're very glad that you can spend some more quality time with this chap.
It's absolutely brilliant hearing Scott explain and see the X-rays and know that he'd got that time. That makes me happy.
Time is going to get us all, but it's nice to think that we can keep it going.
Scott has one special X-ray image he still wants to share with Brenda and Marie.
So let me just show you.
Oh my goodness!
Look at it. Isn't that extraordinary? It looks like he's got like a bony pom-pom on his head.
It does. It looks like it's just stuck on.
Might make the Guinness Book of Records, I'd say. Is the first ever diagnosed unicorn.
You're a one-off. We knew that, didn't we? Yes.
Yeah, it's connected.
Is it?
Yep.
In New South Wales, Audrey and Alison face a massive challenge, with an ultrasound confirming that rabbit Chimera's nasty abscesses are connected to major blood vessels.
If we nick any of those vital blood vessels, that would be really bad news. He could die, and so we really want to avoid that at all costs.
Time's of the essence, and this guy cannot have a long anaesthetic. Oh, he's up again.
But before surgery can get underway, the team is battling to stabilise Chimera.
Rabbit anaesthetic is always tricky. They go a little bit light, they go a little bit deep, and in Chimera's case, I'm keeping him low on all the anaesthetic drugs because he potentially has some liver and kidney issues. So we do have to tweak the anaesthetic every time he gets a little bit light and starts moving. We've got to turn the gas up, and then sometimes he goes too deep, and then we've got to turn it down.
You go scrub, just in case anaesthetic goes boo, and then I'll scrub last, but you go scrub first.
Okay.
He's on 2.5, and his oxygen flow rate just slightly high odds, but he's stable.
He's moving, he's moving. He may not just like that. Yep, he's feeling everything.
Chimera is still unstable and will feel pain if he's not fully anaesthetised.
Just gave him a little bit more injectable anaesthetic, just to get him a little bit deeper.
All right, try and do this without bursting it.
He's not feeling that, so that's good.
So part of this abscess has already ruptured, but I actually don't want it to burst fully because if it stays full, I can actually find the capsule and take it out like a ball. Oh, we're not happy, Alison.
Huh?
We're not happy.
All right, let me scrub. Oh, so we're scrubbing really quickly because he's been really unstable under anaesthetic. So I just want to make sure that we're in and out as fast as we can. So 2 surgeons might be faster than 1.
Don't you dare burst on me.
Oh my God,
disgusting, ropey.
And if we burst it, the problem is we're spreading the infection. So we really want to keep this abscess in its capsule.
There we go, hold the abscess. Look at this abscess.
Look at it.
It's like a worm.
Look. It looks like an alien. It goes into little crevices. It's strung all together. I've never seen anything like it. It's like a caterpillar. And the more you pull, the more is coming out. Wow, right?
Wow.
Just wow.
This is, look, it's coming down to join to the other one. We were right.
It is going around, look.
All right, I think we're good. We're gonna flip it.
Audrey and Alison must now try to safely unravel the bizarre abscess where it's wrapped around Chimera's leg.
Don't hit the artery, don't hit the vein.
I know, she really stressed me out. You know, like my levels are like already a bit high right now. So this string of abscess, Audrey's put her scissors through, is actually connected to the other side. So we were right, it's sort of wrapped around the stifle. It's pretty cool, huh?
Ooh, pass. All right, I got it, I got it.
Finally.
Ready, and
woohoo! Wow! Oh my God! Look, it's like
that's
got
our string of abscess. It went around the leg like that.
Abscesses are disgusting, but it's kind of that intriguing disgusting.
And it's actually, if you get it and you drain it or you remove it, it's like instant gratification. You know you've done a good job. You know you've got that infection out. I think there's nothing more rewarding than curing an abscess or getting it out. I really love abscess surgery.
That was really
super cool. But as much as we want to enjoy this moment, we're going to suture up.
Absolutely.
With the massive abscess out, the girls must now stitch up the wound and wake up Chimera as quickly as possible.
Hello. Hi, cutie.
Such a cutie.
He's so cute.
While Chimera slowly recovers, The twins are fascinated to explore the extraordinary alien growth they removed from
Ali,
his
can we cut
body.
this thing open?
Yes, I'm excited.
All right. So it's the end of surgery, and we have the sick desire to cut open.
It's not a sick desire, it's actually part of the investigation
It's actually
process.
a true part of this investigation. We need to open it up and find out what's in there, and is it pus?
Okay, wait, where is the most juiciest? Ooh, look at that multi-lobulated. And take a sample for culture and sensitivity, because we know he's been on all these different antibiotics, but they may not be the right antibiotics for the type of infection. So getting right into that pus sample and getting a little sample, sending it off, is what we need to do. So we've got to cut this thing open.
Much to our delight.
Much to our delight. And as vets, this is the fun part. Oh God, that's tough.
Oh God, that's why the antibiotics don't go through that.
Yeah, no wonder.
Ooh, pop goes the weasel.
Oh, Iona, I think you're right. It's custody. Oh my God.
Oh yeah. Okay, slice the whole thing. I want to see the whole thing.
Oh my God.
Yeah. This is amazing. I can't contain my excitement right now.
As vets, we love gory, pussy.
It's intriguing because you see the same thing a lot of the time. So when you see an abscess, that's pretty cool. And when you see a string of abscess, that's even cooler. In we go. Off to the lab. As well as being, scientific and it's all part of our investigation, just to cut that thing open and find out what's inside, that's some sick pleasure
Our
there.
job is never dull.
Viscosity.
By now, Chimera is fully awake and ready to be moved to a cosy bed so he can continue to recover.
Off to bed, my little one. And hopefully when he goes home and he's in his own environment, he's going to start chewing some grass, and so it couldn't go any better. It was just a perfect recovery.
Come on. Oh, mister. Oh, you're a brave boy. Okay.
On the Gold Coast, Alex and her team have managed to stabilise Diesel, who appeared to be going into shock after a vicious attack by a large dog.
Right, you sit in there for a little bit, my friend. Good boy. We've got the oxygen on there.
While they wait for the intravenous fluids and pain relief to take effect, Nurse Patrice runs blood tests to find out why the 7-month-old is having trouble breathing.
If a dog bite goes into the body cavity, organs can be damaged, it can cause internal bleeding. The blood test is a blood gas analysis, and that will show us whether Diesel's lungs have been damaged and whether he's able to oxygenate properly.
Pretty unremarkable considering how sick Diesel is.
Yeah, that's good. All right, so yeah, bloods at this stage look okay, so he's oxygenating okay. Electrolytes are fine, lactate is normal, so these are good early signs. Hey buddy, how are you feeling? The next step for Diesel will be to perform chest x-rays and an abdominal ultrasound, looking for any sign of internal injuries. Come on, good boy. I think he might be a bit sore, so I'm just gonna pick him up real careful. All right, my little man. I gotcha. Good boy, it's okay. I gotcha, let's go through. Come in, little man. Get down there. Good boy, Diesel. Good boy, Diesel. You're very quiet, aren't you? Yeah, I don't know Diesel very well, but cats are just not usually quite this tolerant. What I'm seeing on the x-rays is a concern because it shows there's bleeding into his lungs. He's got a nice clear lung field up here dorsally, but down here this looks quite abnormal. It could be contusions, which is bruising in the lungs where you get bleeding into the air sacs. Lung contusions can be life-threatening, where there should be air in the lung sacs, there's blood. If too much of his lung is involved, then he may not be able to breathe properly. I need to be sure a tooth from the dog hasn't penetrated into his chest cavity. So it's going to be really important that we clip this area up and look for any bite wounds. Okay, here we go. It's going to be a bit noisy. Good boy. Yeah, it's hard to tell what's just doggy saliva and, oh no, there we go.
There we go.
Yeah. Oh, that doesn't look good. Yeah, he's got a big bruise there.
Brave boy.
How did you get to be such a good girl? I don't know.
In Bondi, Kate is preparing Pawpaw for surgery to repair the 5-year-old's ruptured cruciate ligament.
This is a really major surgery for Pawpaw. One of the biggest parts of these types of procedures is pain management. And the way we do that is through a whole variety of different techniques.
Kate has brought in orthopedic surgeon Dr. Eugene to conduct the intricate reconstruction of Pawpaw's knee.
A very, very important part of the orthopedic surgery is ensuring that the animal has the minimum discomfort. Evie is now blocking two of the most important nerves that supply the knee, the sciatic and the femoral, and that should result in a pain-free recovery for the animal and less anxiety.
Eugene, I trust implicitly. He's my favourite surgeon. He's from Northside Specialist Centre. So today, the fact that we actually managed to get Eugene to do this surgery, this is pretty special.
So now as we go into it, we have a look inside and we can see that this joint is not going to be a happy joint.
What makes you say that?
Well, you can see the discoloration of the joint fluid. You can see the partially torn cruciate ligament in there. Can you see the little fibres of it?
Yeah.
And there's only one part of the fibre there that looks intact still. Can you see the nice shiny white one?
Yeah.
That's normal fibre.
Right.
All the rest of this
is
broken or degenerated.
Yeah.
80% of this cruciate ligament is diseased. We do a very interesting surgery for the treatment of this cranial cruciate ligament injury in dogs, what we call a corrective osteotomy. It is a very invasive procedure. We actually break a bone and alter the angle of the knee so that we remove all the strain on the ligament. There's a really important blood vessel in here that runs in the popliteal fossa, and all I do is I just get between the bone and the blood vessel and I just push it away gently, just so that we don't cut it with our saw. It can lead to loss of blood to the point of fatality.
Apart from damaging vital blood vessels, the high-risk surgery carries many other potential dangers.
So what I'm doing is I'm isolating all the soft tissue structures from the bone because I'm going to take a saw now, I'm going to cut it, and I don't want to damage my soft tissue structures.
And this is the risky part.
Yeah, the biggest risk is the bone cutting goes wrong. Your saw can slip or malfunction and you can end up cutting into the joint and creating a very, very bad fracture.
Right, so this is the moment.
Yeah, so this is the gory bit.
Whoa.
Oh no, there we go. Yeah, he's got a big bruise there.
On the Gold Coast, Alex is anxious to find out just how badly Diesel has been bitten during a vicious dog attack.
I just don't want to see any puncture wounds. That's what I'm hoping, that we're just going to see bruising. What I'm most worried about here is that we'll find a penetrating injury. One of the dog's teeth has gone through the skin and into a body cavity. And if that's the case, there could be organ damage, he could have internal bleeding, it could be really nasty. Certainly got trauma from being bitten. Just hoping that none of the wounds go right through, and so far so good. So we've taken the x-rays of Diesel and we've clipped his hair off, and it's good news. I'm not seeing any bite wounds on him. He does have evidence of bruising to his lungs, but so far I think Diesel may be a lucky boy. Come on, my little friend. Okay, last thing, we'll just whip you through to ultrasound.
Alex wants to do one final scan to confirm the 7-month-old has escaped serious internal injuries.
All right, you ready, Diesel? Are you ready? Here we go. Good boy. So I'm just looking around his belly here for any fluid where it shouldn't be that would be an indication of internal bleeding. Just looking up around his kidneys, that all looks fine. There's bruising to that muscle tissue, but underneath that, inside his chest, the lung goes all the way to the edge of the chest wall, and that's a good sign. It shows us that the lung's fully inflated. So a lot of what we're seeing is bruising. It's not great for Diesel, it's going to be uncomfortable, but this is good news. This is something he'll heal from. I gotta say, when he came in, I was worried.
So was I.
And I think
this is looking promising.
Yeah.
This is great for Diesel, great for his family.
I think he's going to be okay. Thank goodness. The ultrasound is clear. This is really good news. There's no internal bleeding. He's got some nasty bruising, but he's going to be okay. I think you are a little miracle, aren't you? Yes, you are.
In Bondi, Kate and orthopedic surgeon Dr. Eugene are performing complex knee surgery on Pawpaw.
So we got the bone and then we line up those two bits.
This procedure is horrific, absolutely horrific. It is like metal work. Drills, there's these cutting things, it's blood and gore, just horrific.
Nice and loose. We didn't cut the blood vessel, we're very lucky. All right, so now we're going to put in a pin to rotate this proximal fragment. So the technique is based on a principle of cutting the bone, rotating it, and applying a stainless steel plate and screws to the leg. And then when that bone heals, the knee is dynamically or automatically stabilized. Look, I'm really happy with the surgery. It went according to plan. Unfortunately, Pawpaw will develop a little bit of arthritis. That's normal, but hopefully this will significantly improve the use of the leg, the degree of lameness, and the long-term outcome. Within a year, this leg should be just as good as a new leg would be. Just put the dog on its belly gently. Come on, sweetie. You just do the tube for us there, please. Disconnect the tube while we turn the dog so we don't twist anything.
X-rays confirm Pawpaw's reconstructed knee is looking exactly as it should.
Hi, Bridget. It's Eugene speaking, the surgeon.
Hi, Eugene. How are you?
Yes, I'm good, and yourself, thank you. Yeah, I just want to give you a little update on Pawpaw, just to tell you that her surgery went really well.
Oh, that's so good to hear.
A reassuring phone call to Pawpaw's loving owners, Bridget and Jack, caps off a successful day of surgery.
The surgery went perfectly, but this is where the real work starts. The post-operative periods, and that means pain management, rehabilitation, physiotherapy, and a whole bunch of commitment from the owners. So we've got a long road ahead of us.
You've got to stay out of trouble. Don't be taking on dogs.
After incredibly escaping life-threatening injuries when he was attacked by a large dog, Miracle Boy Diesel is ready to go home.
Diesel is one very lucky cat. He's had a horrible day and I'm sure he wishes he wasn't here, but it could be so much worse.
Hey, you ready? Let's go.
Owners Anton and Miranda are waiting anxiously to be reunited with their much-loved 7-month-old.
Here he is. I'm going to pop him over here. He's a good boy. He looks a bit strange.
Yeah, that's all right.
What do you think?
That's all right. I'm just glad he's okay.
So what we did today was really to make sure he didn't have any internal injuries. So chest x-rays, he does have some bruising to his lungs,
Okay.
but that will heal with time. He's obviously got those nasty bruises on the outside, but other than that, he's very lucky. How does it feel to be able to take him home tonight?
I'm very grateful. I was worried that he was in worse shape than what he actually is.
Yeah. I love his collar, his little sparkly collar.
Yeah. We got that back when we thought he was a girl.
Oh, I did wonder about that. I was like, that's a very pretty collar for a boy.
Yeah, he was called Wendy, and then we went in and had him desexed, and they were like, this is a boy.
That was such a special moment to reunite Diesel with his family. It's been a traumatic day for all of them, but bringing them back together, this is the best part. All right, great that you brought him down today, and I'm glad we could at least get him on the road to recovery, but I think what he needs now is some TLC.
Yeah.
Thank you.
Thank you so much. You've done an excellent job.
You're welcome.
Very, very
See you later, mate. You stay out of trouble.
It looks super happy. All right.
We'll see you later.
Okay, bye.
Bye.
In Suffolk in the UK, Scott and Scully have come to the beach to catch up with Brenda and her adored dog Maximus.
Hi there, Brenda. How are you?
Scott.
Good to see you.
Good to see you
Hi.
too down here.
Hello, Max.
Who's
How's it
this,
going?
Max? Who's
Hello,
this?
buddy.
It's 6 weeks since Scott placed the Shih Tzu on medication to help with the arthritis that causes the 14-year-old to walk abnormally.
Do you think you've seen an improvement with the use of the medication?
Yes, definitely. He doesn't limp as much now when he's walking, especially down here. And Max is happy, so I'm happy knowing that he's not in pain.
Up you get. Good boy. Well done. He's still an incredibly wonky walker.
He is. Yeah. It's like one too many to drink, isn't it?
Yeah. One too many, I think about 10. Under the term tenacity in the dictionary, there's Maximus because he falls down and he just gets back up again. I really hope for both him and Brendan that keeps on happening for as long as it can. Now he's out of pain, I feel like it's okay to laugh.
Yes, yes, that's
It
right.
is the world's funniest walk.
While Max loves the beach, it also has a special place in Scott's heart.
Betty was my dog for 14 and a half years. I love the beach because it's a place that Betty absolutely loved. She'd come alive. She personified the heart dog, the dog that is really special.
Sadly, Scott had to let Betty go when she was the same age as Max and suffering with similar ailments.
I had to say goodbye to her about 2 years ago, and it was really, really painful. To let go of Betty was the single most difficult decision I've ever had to make. It was gut-wrenching. And as a vet, you give guidance regarding saying goodbye to beloved pets every day. But when it's yours, it's something altogether different.
You are just gorgeous. You're my gorgeous puppy. Yeah.
Thanks to Scott, the special bond between Brenda and Max will continue for a while longer yet.
Oh, I love you. Lots.
Pawpaw, come here.
In Sydney, it's 2 months since Pawpaw's knee reconstruction, and owners Jack and Bridget are amazed at how quickly their much-loved girl is recovering.
Good girl, come on.
Now 6 years old, she's relishing strenuous activity, and all indications are her injured left leg will soon be as good as new.
Woo! Wow.
And a month after Alison and Audrey removed a complicated abscess from rabbit Chimera, he's now fully recovered. Carer Emily is confident once he's de-sexed, he'll be ready for a forever home.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.